All right, so this is my guide to being a graduate, the part that people are probably more interested in, which is talking about selection criteria. So, first things first, what is a selection criteria? And essentially, the selection criteria is where the employer outlines the skills and requirements that are necessary for them to meet the job requirements. The good news is, if you correctly address a selection criteria, you have met all of the employer's requirements for you to be employed by them, which means theoretically, if a hospital actually receives less applications than what they have positions, they could hire you directly from your selection criteria. They do not need to interview you. That being said, never going to happen with Grad Connect because there's so many applicants. You're always going to have to do an interview, but just keep it in your heart when you're feeling all scared and nervous. If you've got an interview, that means that's because the hospital is happy to employ you. You've met all of those requirements. You've now just got to prove that you're better than everyone else, which is always the slightly scary part. When addressing a selection criteria, it is your responsibility to demonstrate that you meet the selection criteria. You can't assume that, well, obviously they would know this about me, or, well, obviously they know that I communicate, or, hey, I've written a selection criteria, that means I can do written communication, anything like that. Like, you must demonstrate that you meet the selection criteria. They have got hundreds of these to read. They do not want to have to try and go hunting and going, oh, do they meet this, do they not meet this? Make it as easy and simple for someone to look at your selection criteria and determine that you have met it correctly. So a selection criteria is marked using a set key. And I believe nowadays that is standardised across all hospitals within the Department of Health in terms of the selection criteria marking key. You need to pass every component of the selection criteria. That being said, that rule is applied more strictly when it comes to further on in your career, when you're applying for positions, just like general nursing positions outside of the graduate process. So you can't be interviewed if you do not pass every section of the selection criteria. Grad Connect is a little bit kinder to you. Most hospitals simply require that you have an overall passing grade, even if one of your selection criteria is slightly weak. Don't rest on that. Like, make each of your selection criteria as good as you possibly can. But just to let you know, they are slightly more generous for graduate employees because this is your first time, as opposed to further on in your career. So, how to answer a selection criteria? So you have got, for Grad Connect, 250 words. Make each of those words count. It's not a lot, but it is perfectly doable. So it's about 2 paragraphs. You can absolutely do it. For my selection criteria, my answers were between 235 and 250 words. You can definitely fit all of the information you need to in that time space. There is no point trying to write an answer that's any longer. The system won't let you put more than 250 words in, and they don't want to have to read more than 250 words. So the kind of classic model for answering a selection criteria is to use the STAR approach, which is talk about situation, task, action, and results. And definitely this is really important if you have any selection criteria which tells you to demonstrate something, because that means you must show an example. Another kind of very similar is the SAO, which is just situation, action, outcome. And these are just about providing an easy, simple way that you are able to show that you are addressing that selection criteria. You don't have to use these models, but it helps because it's the most commonly used. It is the way that the people reading the selection criteria are most familiar with seeing the information presented, which means that they don't have to go hunting for that information. The easier you make it for someone to mark your selection criteria, the happier they're going to be with your selection criteria. So this is an example. So this is a question. This is not taken from Grad Connect. This is just taken from just an RN job advertised by the Department of Health. But this is a fairly common, this question or variations of this question appear in practically kind of like any sort of RN job for the Department of Health. So demonstrate. So first of all, this means if a question asks you to demonstrate, you need to provide examples. And it's asking for 3 things. It wants to know about your verbal communication, your written communication, and your ability to work effectively within the multidisciplinary team. So you need to make sure that you include all 3 of those things, that you have demonstrated all of them when you write your answer. So this is kind of a brief little example that I wrote in response to this. So whilst on clinical placement, I identified a patient who was due to be discharged, was scared about showering himself at home. So this kind of situation. So what'd you do? I contacted the occupational therapist. So here you've identified that you're working with a multidisciplinary team. and I provided a verbal handover of the patient using the Eisenbar format. So here you're talking about verbal communication. And I would say, if in any of your selection criteria you were talking about providing a handover, always specify that you would use the Eisenbar format, because it is Department of Health policy that an Eisenbar format should be used for all handovers. So include that in your selection criteria. It's going to be a little gold star. Rather than just simply saying that you communicate verbally, you're saying the format that you've used to communicate. And so provide a verbal handover using Eisenbar format and request that they review the patient. The occupational therapist was able to organise a shower chair for the patient and ongoing assessment at home by community services. So you've shown that you've worked effectively with a multidisciplinary team, you've met the patient needs. Finish up with, I documented the actions I had taken and the results in the patient progress note so that other members of the team would be aware of the outcome. So here you're also showing that you're able to use written communication. And here it's in the example of the progress note. So this is only, as you can see, a very short, brief little example. You're going to probably expand a bit more on these ideas. You might want to use another example to kind of follow on from this. But it shows you don't have to use 500 words to be able to answer a selection criteria like this. You can do it quite efficiently. So another example of kind of using that STAR format and a kind of good way to answer a question in a slightly silly example, but say, demonstrates ability to manage unicorn infestations in public hospitals. So the situation. Whilst on my clinical placement, I discovered rainbow poop in a patient's room, which led me to believe that there was a unicorn infestation. Task. As an RN, it is important that I ensure that unicorn infestations are managed as per Department of Health policy. So what action did I take? I reported a suspected infestation to my buddy nurse, and we completed an infestation report to facility management as per hospital policy. And the result was facilities management attended within 24 hours and located and removed the unicorn, ensuring that patient and staff safety was maintained. So in this answer, you have demonstrated that you have the ability to manage unicorn infestations in public hospitals. Good answer. So what's an example of a bad answer? And by a bad answer, I don't necessarily mean an answer which has got really poor grammar or really poor spelling. I'm sure some of you have probably noticed some spelling and grammar errors in my PowerPoint. A bad answer doesn't mean that someone hasn't put effort in. Sometimes people put so much effort into their bad answers, but it's a bad answer because it does not address the selection criteria. So, for this same question, demonstrates ability to manage unicorn infestations in a public hospital. Unicorns present a major risk to the health and safety of patient and staff within public hospitals. Evidence show that up to 20% of hospitals will experience an infestation each year. It is important that the registered nurse has the ability to identify and manage unicorn infestations. Signs of unicorn infestations include rainbow poop, glittering corridors, and the sound of giggling. If any signs of infestation are seen, the registered nurse should ensure that this is reported immediately using appropriate policies and procedures. Now, there's been effort put into this answer. It's included, talking about the evidence, the signs, all of that. The problem is this has not answered the selection criteria. You're writing an answer like this, you have not demonstrated that you have the ability to manage the problem, and that's what the question is asking about. This kind of information might be appropriate to use if, for example, the question said, demonstrates knowledge of and ability to manage unicorn infestations, because then you would combine those two previous answers. You would combine that knowledge about surrounding, what is a unicorn infestation? Why is it a problem? How prevalent is it? Combined with then demonstrating your ability to manage that. But it's really important that you don't waste words providing information that is not asked for in the question, which is why that previous one was a bad example, because it had used a whole paragraph providing all of this information for which you would have got no marks at all in a selection criteria, because it's not addressing the requirements of the selection criteria. So in my next kind of presentation that I'm planning to put together, I will look kind of a bit more detail into addressing the previous Grad Connects questions. They can vary slightly, but just kind of pulling apart the questions from previous years and kind of ways that you can address those.